Hi everyone, my name is Hannah and I work in the COMAC office, and I'm here for this Tuesday and the rest of the Tuesdays this month to talk to you guys about some tips to practice speech and language at home. So today I'm going to be talking about a few stuttering modification techniques. So stuttering modification is a way to help speakers who stutter change their stuttering so it's not as tense, long, or as disruptive to their communication. So it's not necessarily to make the individual more fluent, although when you're decreasing your tension and changing your stuttering, you're more in control of your speech and usually fluency increases. So there's 3 ways that you can change a moment of stuttering. So it can be either after the stutter, which is called cancellation, before the stutter occurs, which is called a preparatory set or easing in, or during the stutter, which is called pull out or easing out. So I'm going to go through each of these 3 techniques today. So the first one is cancellation. So cancellation involves modifying tension after a moment of stuttering is over. So it's not just replacing stuttering with a fluent speech or fixing stuttering. Cancellation helps us to learn how to modify, manage, and reduce the tension following a moment of stuttering. So I'm going to show you an example, and when I do it, I will be using pseudo-stuttering, and then after I'll explain what I did. So if I say the sentence, I want that, and I was a person who stutters, and say I stutter on the word want. So it would sound like this. I want that. So if you can see, on the first time I produced want, I had a lot of repetitions and a lot of tension. But when I produced it the second time, it was less tense and I had a few less repetitions. So the second production is not completely fluent, but it's a modified version of the first production. So I'm gaining more control and I'm able to reduce my tension when I speak. The second method that I'm going to explain is pull out. So pull out involves modifying tension during a moment of stuttering. So it's not just stopping the stutter and saying the word fluently. It again helps the person who stutters learn to modify, manage, and reduce the tension during a moment of stuttering. And this one is a little more trickier for me to show and a little more tricky to learn. So during the stutter, I'm going to reduce my tension and kind of slide out of the word. So I'm going to use the same sentence again. If I were to say, I want that. So you can see that in the beginning I had a pretty hard block and a lot of tension, but I slid out of the word want and I was able to complete my sentence. So the tension is decreasing during my moment of stuttering. Again, this method is called pull out, and it's also known as easing out or sliding out. The last technique is called a preparatory set. And this involves modifying tension before a moment of stuttering occurs. So very often people who stutter have trigger words or words that they know are going to be more difficult. So it's not necessarily avoiding the stutter or stopping the stutter before it starts, but again, it's helping the student to reduce the tension before it builds up so they do not initiate the speech with a tense posture. It's kind of hard because I'm not a person who stutters for me to practice a preparatory set because my tension that I'm experiencing isn't technically real, but I'm going to kind of try and demonstrate. It's also called easing in. So if I'm going to use the same sentence, I want that, and I know that the W gives me a very hard time, I would say, I want that. So again, as you can see, based on my other examples, I'm not having as many repetitions, but I'm sliding into the word want with gentle, easy speech. So again, let me show you. I want that. Alrighty, so those are my 3 techniques for stuttering modification. Remember, cancellation is after the stutter is over. Pull out is modifying the tension during a moment of stuttering. And preparatory set is modifying the tension before a moment of stuttering occurs. These techniques are really good for school-age children who stutter, teenagers, and older adults because they really need to understand and know about their stutter and what words give them more difficulty And like I said in the beginning, it's not about decreasing and making yourself more fluent. It's about giving yourself more control over your speech and reducing the tension as you talk in situations that may be more anxiety provoking and cause more disfluencies. So I hope you enjoyed, and I will see you guys next week for another therapy tip. Bye!